I'm Dr. Bodzioch of Atlantic Chiropractic in Stoneham, Mass. Your posture doctor. Today we're going to talk about torticollis. Okay, so torticollis, generally speaking, is when someone gets spasticity, tightness, tension, spasm in these actual neck muscles. Your neck muscles, so essentially it's from your collarbone, which sits obviously right in your mid chest area, and those muscles from the collarbone up, okay, are tight, spastic, inflamed, tender, locked up. There's obviously a lot of different verbiages and linguistics you can use for that to reflect what happens. As those muscles contract, and the majority of them are your trap muscles, right? Your upper trap muscles, your SCM muscles, which run on the side of your neck, which is your sternocleidomastoideus. Say that 3 times, right? Your sternocleidomastoideus, your levator scapular muscles, okay? And then remember you have your suboccipital triangle muscles that run at the base of the cervical. So in most instances, when that torticollis and this tightness occurs in the neck, it's going to first of all pull that neck out of its cervical curve, okay, and reverse that curve, and the chin's going to go forward, and then most instances you get rotation of this neck, okay? So you show the tone of the muscles pull the head forward, and then the suboccipital triangle in there, the 3 bands of muscles, rotate the neck. So your head's down and rotate it. And it's spastic. So that's a general description of torticollis, okay? Which is spasticity, tightness, tension in the musculature from the actual collarbone up, particularly the upper trapezius muscles on both sides, particularly your sternocleidomastoideus muscles on each side of the neck, your levator scapula muscles on each side of the neck, and then your suboccipital triangle muscles, which is the 3 bands of muscles at C1, C2 at the base of your neck. And because there's no slack, the head doesn't drop back, right? So the slack is gone, the curve is non-existent, so the curve comes forward as the muscles pull, and as muscles pull, the skull drops forward into the actual sternum or into your chest, and once the actual suboccipital triangle gets activated with spasm, they rotate this head. Now that doesn't have to happen, right? Your head doesn't have to go forward. Your head doesn't have to rotate. But in most instances that happens because there's more tightness on one side of this neck versus the opposing side of the neck, which creates an imbalance. And because of the imbalance, there's rotation. Because of the imbalance, there's forward head carriage. And then your shoulder might pull up. Now, because of this spasm or tightness, what happens, right? Now your swallowing gets challenged. Okay? Because these muscles around your throat, okay, or your esophagus here, are starting to collapse that esophagus or are encroaching on that esophagus, so your swallowing's challenged or compromised. Okay? Because these muscles in your chest are irritated or tight and wound up, what it's doing is pulling that sternum forward, so it's collapsing your thoracic cage, okay, which also is going to cause some pulmonary or breathing difficulties. Now remember, the base of the neck, those nerves go out to the shoulder. So now when these nerves are irritated at the base of the neck, that's a motor deficit. Because of the motor deficit, now what happens? You get shoulder irritation. Or maybe you get weakness in the shoulder, or your ranges of your shoulder are compromised or irritated. And then because of this irritation on the neck and it's going to the shoulder, now you're getting fingertips, numbness in your fingertips, tingling in your fingertips, spasms in your forearm as a result. Maybe you get a twitch in your eye, or maybe you get spasm in your masseter or buccinator muscle in your facial features, so now your jaw's clenching up on it. Again, remember, the nerves get irritated. The nerves are the coach or the software that runs the hardware. So as soon as the software is compromised, the hardware's got to be compromised. Now remember, what runs those muscles is neurology. So the neurology's got to be challenged or irritated or aggravated in regards to what message or instruction or direction that it's sending these muscles. So now that changes the tone of the muscle and the balance of the muscle, which causes more spasticity, more tightness, more tension, which causes aggravation to the balance of what's going on in this machine as far as tone. So now we get breathing, we get strength of the shoulder, we get range of motion in the shoulders, we get residuals of tingling in the fingertips, numbness in the fingertips, spasms in the forearm. You get irritation between your shoulder blades, right? Because everything's getting pulled forward. Those rhomboids between your shoulder blades are trying to compensate, so they're trying to pull back. And obviously, right, what happens as this pattern, right, becomes longer and longer? So you at home, right, Mr. Smith, you start spending 1 day in this pattern, 2 days in the pattern, 3 days in the pattern, a week in the pattern, 2 weeks in the pattern, 4 weeks in the pattern, now a month in the pattern. What do you think is going to happen in regards to trying to get it out of that pattern? Right? It's going to become more difficult. Because the longer the pattern sits in the body, the more it becomes anchored in the body, and more it becomes anchored, the more difficult it is to alleviate that pattern or erase that pattern to try to get it back to a norm. That's general responses and definitions of what torticollis is, what it causes, and the consequences. Now we're going to go over specific types of torticollis cases. So, first one is congenital torticollis, which usually affects infants to 2 months of age, give or take. Okay? So, 3 ways that can occur is by birthing trauma. Okay? So remember, birthing traumas, we can go into all kinds of stuff with birthing traumas, but so these calipers, right, are what they use to pull out the baby's head. With a little imagination, you can understand, right? If that baby's cocked in there, they're torquing on one side versus the other side, it's not even the way they're pulling out. What's going to cause is a lot of pressure, tension here, and even mechanical dysfunction, right? Especially in a baby. They're not developed. They're just in a state of development. Everything is very pliable, especially that neurology. So in us, that neurology is like overcooked pasta. So you can understand in a baby, it doesn't take a whole lot of torque or irritation to tweak this C1, C2 in their neck and agitate that actual base of that brainstem. Okay? And that's going to cause irritation in what? That actual musculature at the base of the neck of what's developed there. The second way they can get this case of torticollis, the congenital one, is through sleeping, right? So the same thing, they sleep in a torqued position. They pull the pillow, the baby pulls the pillow underneath their chin. Now the chin's torqued up for a period of time, and all of a sudden the muscle starts to respond and go into spasm. Okay? Just understand this is a baby, so their neurology is just starting to develop, and it's not used to long patterns. It's almost offensive to long patterns. Okay, so that spasm, that tightness, if they're in there for a long period of time, that they're sleeping, through a 5 or 6, 7 hour period of time, and they got their head jacked up, that's going to irritate and cause this torticollis and that spasticity. Okay, and the last way is sitting in one position. Right? So maybe you got them in the crib or they're in their bassinet, and you're taking them on a ride or whatnot, and they happen to fall asleep, and they fall asleep with their head laying to the right hand side versus not drop back evenly, and their head's to the right side, and then they wake up and they're not moving their head's locked to that right side in a lateral flexion. Postural torticollis. Okay, so postural torticollis is when the baby's in one position for a long period of time. Okay, it doesn't take an Einstein to figure something out like this, right? So let's just say, they're in the car seat a lot, they're traveling a lot, or you're going on vacation. Unbeknownst to you, the parent, same way, right? They're in the car seat and they fall asleep, and maybe it was cool in the car, and you wrapped a blanket around them, but the blanket bunched up on the right hand side, unknowing to you, the parent, and now he puts his head down, or she puts her head down on that blanket and on that bundled, wrapped up blanket, and it causes this lateral deviation, and he's in there for a 6 or 7 or 5 hour period of time. So that's really easy in regards to a baby. In an adult, right, postural torticollis, same thing, right? They're in these postural positions. They're at their computer looking down, the screen's down. You know what? They got a high seat, their head's down, their shoulders are rolled forward, they're looking down, and they're doing that day in and out, and all of a sudden, you know what? One day they're sitting there and somebody calls their name and they can't even turn their head. So again, it goes back to patterns, okay? It goes back to repetitiveness, and it goes back to consistency. And obviously, in an adult, we need that pattern, we need the consistency, the more repetitive thing, and more frequent than a baby, right? That's my point. Because a baby doesn't have these patterns established for a long period of time because they're a newborn. So again, right, just a short period of time in one position in that car seat can crank that neck up on a baby. Okay, so it's very time sensitive as far as a child or a baby's concerned versus an adult, right? They're doing this repetitively day in, day out, months, weeks, months, years, and to the point where now, they're so used to it that when they reverse that posture, the body's starting to actually fight it, right? Or can cause conflict with that because it's more comfortable in the pattern than going against the pattern. So when the adult starts to go against the pattern, it starts to lock up, it starts to irritate, and it goes into a spasm. So that's the postural torticollis. And the third one is spastic torticollis. Okay, so spastic torticollis can occur in children or in adults, right? It can occur in trauma. So what's a trauma? How about a car accident, right? So you're sitting in traffic, mind your own business, and wham, you get hit from behind, right? A rear end accident. And you're not even aware of it, and your head whips back, and it whips forward, and that whipping motion really traumatizes these muscles and these ligaments and these tendons, and to the point where they're so traumatized they go into spasm, right? Because they're trying to protect you, literally, and protect those joints from getting further irritated and traumatized and hurt. So traumatized, right? Inflammation, right? It can be caused by inflammation. So you're working these muscles so hard that you're doing it constantly. So maybe gymnastics, right? Where they're working out all the time and they're constantly doing flips, or they're constantly doing rolls, okay, or their pommel horse, where they're flipping over the pommel horse, and they're constantly working and challenging those muscles, and the muscle gets so fatigued it goes into spasm. And the same thing, we go right back to what? Ergonomics, right? So somebody's sitting at the desk. Somebody's not sitting at the desk anymore. Where are we sitting? Dining room tables, because of this virus. So the tables are up here, tables are down here. You're looking down or you're looking up. Your hands are way up here, they're not comfortable. Your hands are down here, really uncomfortable. Really aggravating your shoulders, really aggravating that neck. So you're starting to stress out because you got a timeline on something that you're doing at work. And then your kids are a little annoyed because they can't figure out something on their Zoom meeting for school, right? And your wife is aggravated because she doesn't have something to cook for to bake her cake. So again, stress, we have to look at stress as a big part of torticollis, because something's causing those muscles to go into that much spasm to create protection and to guard those joints so there's not further irritation and irritation and breakdown in those joints as a result. Okay? And in most instances, besides obviously the infant, okay, but when we get into adults, you're already cranked up because of some kind of stress, whether that be physical stress, mental stress, emotional stress, chemical stress. So maybe you're on some kind of meds for emotional balance. And because of that med, those muscles are already inflamed and irritated to begin with before you start your daily activity, right? So you're already what? Teeter-totter. And because you're teeter-totter, it doesn't take a whole bunch to what? Throw you off that kind of balance, right? So just a little bit tips you over. So again, whether that's the trauma in the car accident, whether that's the trauma are you sitting at the dining room table, whether that's the trauma because you're a weekend athlete, right? So you're banging away all week, and on weekends you go out and ski, or you go out and play tennis. So you go from 0 to 100. And your body just can't make that compensation, and it can't adapt, so it breaks, it does the best it can do. What does it do? It winds it up, goes into spasm, and tries to protect those spinal joints and that neurology. I just, again, understand your body does the very best it can, and in most instances, regardless what you might think, it does what it does to try to protect you. It's really trying to do its best for you to be protected from further irritation or further chronic pain or aggravation. So that's just a safety device, right? When the muscles go into spasm, when they go into tightness, okay? They're just trying to protect those joints from further irritation, further breakdown, further irritation, and trouble down the road. Okay. So again, right? Like I said, I love making these videos, and I'd really appreciate it if you give me a little loving back, and if you hit subscribe on the YouTube channel. Okay. Again, we'd love to check you out. If you see this torticollis, mention this clip. We'll give you a 10% discount in regards to your workup to see exactly what's going on. Okay? But you know your body the best. When it's not functioning like it needs to, the longer you wait, the longer those patterns get in there, the more the musculoskeletal system starts to compensate, and the longer it's in that compensation mode or that compensation pattern, the more aggravating and more challenging it is for us, the healthcare provider, to get that out of there and try to reestablish a normal balance for you. Okay? Thank you for your time. Really appreciate it. Have a major Monday. Look forward to speaking with you and checking you out. Have a great day.